I didn't see any signs that he was going to do what he did.
This illness can affect anyone at any time, at any age.
I was a 21-year-old who hit rock bottom.
By the time I was 17, I was in rehab. And then it just escalated into a full-blown addiction.
Every patient at SalusCare brings with them very individualized needs, and we develop an individualized plan of care. Almost 50% of the people we serve are also managing a substance use disorder, meaning they're using substances to be able to manage the symptoms of the mental illness.
I had nothing, no respect for myself, just living a life of desperation. When I was about 14 years old, I had an illness, and so I was prescribed a lot of medication. The older I got, the more I realized that the more pills I took, the better I felt, and that developed into, exploring and experimenting. I didn't know where to go. Somebody had told me about SalusCare, but I didn't have any money or insurance. And I found that. I didn't need anything. I walked in the door, and here I am.
My child died by suicide, but he died from depression. You never really think it's going to happen to you and your family until it does. His sophomore year started off badly. He broke up with a girlfriend, and that's where things went downhill. We found out he was cutting. We just had no idea. It was such a shock to find him that day. It was one of those moments where your world shatters into millions of pieces. If we can remove the stigma of suicide and mental illness with an empathy and a compassion, we can make huge strides in helping these kids and solving the problem.
I'm one of 4 boys, and something along the way went south for me. I landed myself into multiple facilities and sought out lots of professional help, and it took years and years to kind of steer away from that. The victory comes from somebody healing. The victory doesn't come from keeping it quiet and trying to hold on to that individual yourself. The hardest part about going on a jog is putting your shoes on and actually getting out the door. And the hardest part about getting somebody to treatment is picking up the phone and saying, I need help for my son.
I think the organizations that are working to provide adolescent mental health care are so important in our community just because the need is so great. And parents need a place where they can go and find out what to do next, where to go, how to help.
Because of SalusCare, we have a great support system and are now familiar with the resources. And anything that I can do in my position in the community to assist and bring awareness to this very important issue for adolescents, especially going through what we've gone through, I'm happy to help.
We're going to start changing lives, and with lives changing, communities change. When communities change, then the world changes.
If they're speaking to you, if they're talking about it, take it seriously, because you don't get a redo on this. There are no second chances. So don't delay. Get them help as fast as you can.
I say thank you. Thank you, and it's, without it, people would die. And it could be your son or daughter next time. You don't know.